Lou Gehrig's disease, or amyotrophic lateral sclerosis. A question on exam won't be a lot on this topic. One of those, as I remember, is on the blueprint will say compare this with Parkinson's disease, as well as with Huntington's. This problem I mean, you're familiar with the ice bucket challenge, right? So this is the disease that they were trying to raise awareness and funding for. Um, the disease is quite um, fast progressing, meaning um, once it starts, the patient is dead in like 3 or 5 years at the most from the time of diagnosis. So the problem here is deterioration of the both upper and lower motor neurons, which of course innervate muscles. Um, so if these these motor neurons, again, upper and lower motor neurons, um, degenerate and die, of course, there will be nothing more to stimulate the muscle. So, of course, the muscles, of course, they won't die all at once. More and more die progressively, and then the muscles, therefore, gradually also weaken because there's less neurons now to innervate them. So the patient will have muscle weakness, atrophy, and twitching. And of course, once the muscles now not only affect skeletal muscles, but it reaches the diaphragm, then of course the patient will um, be unable to breathe spontaneously. They'll be on a ventilator, and the outcome. Okay, so they will eventually die from a complication, from a respiratory complication, along with complications of immobility, such as pressure ulcers, from which they could get sepsis, or they'll throw a blood clot, okay, and who knows what else, or just simply aspirate. Manifestations. It really depends on which body part of the body is affected first, because it will affect your entire body. There's no specific pattern about where it starts, unlike myasthenia gravis or Guillain-Barré syndrome. So this one can start affecting several muscles all at once, or it can also affect the bulbar muscles, those involved in swallowing, chewing, and speaking. Um, the pattern, of course, is just weakness, okay? General complaints of muscle cramps, stiffness, and weakness. So once it hits the bulbar muscles, now the patient will have slurred speech, difficulty swallowing. Uh, Again, the disease is progressive, so the weakness can progress quite fast. And as far as diagnosis, I mean, it can run in the family, so um, family history will be one of those that will help, along with these laundry of tests here, which by now you would already know these are not specific for ALS. What is the purpose again of running these tests? If you said to rule out other causes, that is correct. Um, Stated here, a lumbar puncture can also be done, and then the CAT scan, of course, may show um, the other possible causes. Again, these are used just to rule out the cause of the weakness, okay, the progressive weakness. I already mentioned family history. The EMG are um, going to determine which nerves specifically are damaged. Again, the purpose again is not to diagnose ALS, but to rule out other causes. So what can I say about ALS? There is no cure. You can delay it. There is one drug called Riluzole, um, but it doesn't alter the outcome. I mean, it is going to slow disease progression, meaning the patient will um, go longer without the need for a ventilator, right? So again, it will only slow down the progression. But the drug is uh, hepatotoxic, meaning it can damage your liver, so that will limit the use of the drug. Um, Other treatments are really symptomatic, okay, to manage these symptoms listed right here. Okay, and they're also mentioned under nursing care over here, right? So the muscle cramps, for instance, um, and muscle twitching. Um, so these are some of the symptomatic treatment. Okay, like you have muscle relaxants. Are also listed here, table 37.5. Here is Riluzole. The rest are symptomatic, like I already mentioned. So you have Baclofen for muscle spasms. They have antidepressants because again, this can affect young people, and nothing sadder than knowing that you'll die and then you grow progressively weak, and then you watch your family, you or imagine, watching yourself becoming a burden to them, and then again, you know that you'll eventually pass away. You have laxatives here. Again, these are part of managing the complications of decreased mobility or paralysis. So prepare to be able to distinguish this from Parkinson's and also from multiple sclerosis. Okay. Here are, as you can see, the actions are mainly symptomatic, just to prevent complications of immobility, aspiration, DVT, um, maintaining, you know, turn schedule, and again, emotional support. Okay, because this is a very sad disease.